you doing this morning?
I'm doing great.
This morning, this afternoon, out where you are. Morning here, afternoon where you are.
Right. It is a little bit afternoon here. We're a little bit late today.
Yeah, technical difficulties with this app. So seems like
Right.
I've been having problems with it for the last, well, since I left, since I handed the control panel over to you.
I broke it. I don't know what's going on. You might have to call Zoom.
Well, we did, and that's how we got it working last Friday. So anyhow, I'll figure out what's going on. It's probably something pretty simple. I'm hitting the wrong button, but anyhow, Andrea, we were talking the other day, and we were talking about just yesterday about what do we want to talk about today. So give us an idea of what we're going to talk about today.
Well, I think that we wanted to talk about a few different things, and mainly the idea that medical knowledge doubles every 5 years. And are we keeping up with that? So we're going to discuss some topics today that, might be new conversation for people. I saw that you posted about how you keep up with medical journals and stuff like that. And it's funny because as I was, getting dressed and getting ready, I was thinking about that. And I thought about a couple of experiences I've had. One was with my mother's neurologist. And you have to, doctors work for us. The medical field works for us, basically, right? They're not supposed to control us. We're supposed to go out and shop for the right doctor or the right procedure or the right thing, right? And if we're not doing our due diligence of finding out what's new in the field that, we need some help with, then that's kind of on us. But the other thing that I thought of, and especially after you put that, you stay up on research and you study medical journals, and how many doctors do that? Like I was an insurance agent, and every 2 years I had to go through extra training, to keep my mind fresh on things or learn new things that had come out, new laws, things like that. So,
right.
If you're going to a doctor that was trained 30, 40 years ago, is he out golfing all the time and he's not keeping up on medical information? I mean, really, you need to qualify some people in your life. Like the example I had is my mother had back surgery. I don't know, it's probably been about 14 years ago now. And it was an older man. And then she started having back issues again. So I took her in. And the day I took her in to see him, he dismissed an MRI that another clinic had discovered something in her back. And he poo-pooed it and said, "Oh, what's this? This is nothing." And, so I started questioning him about it. And in the end, he said, "Well, it is pretty big. We should probably do something about it," But the point was that he was an older gentleman, and just me aging, now that I'm getting younger, that's better, but just me aging, I recognize that there's certain things I don't do as well as I used to do. Sometimes we don't see as well as we used to see. Sometimes our hands don't work as well as they used to work, So you kind of have to qualify your doctor, Is he up on the latest and greatest? Is he, is his body functioning well? Because we ended up taking my mother somewhere else to a much younger guy. And the younger guy said, "Well, I just probably wouldn't have done her back the way that he did it."
Right.
So, you just have to kind of look at that stuff, like qualify your medical resources, just like we qualify the products that we use.
That's right. So. And that's interesting, Andrea, because when I was coming home from Australia last week, a week ago today, I was on a plane from LA to Minneapolis, from LAX to Minneapolis Airport. And the couple that was sitting next to me, they had just flown back. They had been in Singapore and Thailand for a month. And it turned out he was a medical doctor from down in Omaha.
Oh.
Retired. He was mid-60s, but him and his wife had gone over to Thailand and to Singapore. And he'd retired, and he'd been retired for 8 years. And I said, well, do you keep up with medical research? He said, oh, absolutely not. I thought,
There you go.
how could you be in the field for all those years and not want to keep up with it? You know,
Right.
just even for your own family and your own friends and for yourself, why wouldn't you want to do that? And he just basically said, I just got burned out on it.
We have a lot of professional people out in the world that are just resting on what they were taught 20, 30 years ago, you know.
Right.
So,
If you read an article, I think it was in New England Journal of Medicine. It was probably a 20-year-old research article. They actually did a research piece and they reported it in the New England Journal of Medicine, and it was called "Where is the Wisdom?" Where is the wisdom? If you wanna Google that, you'll probably find it. New England Journal of Medicine. Where is the wisdom? They went out and they surveyed medical doctors, and they said in the survey, where do you get your research? Where do you make your decisions? What helps you make your decisions on what you recommend to your patients? And it was interesting. The answer was from the medical journals. Now that was back, 20 years ago, so we really didn't use the internet as much as we do today.
right.
And so the answer was the medical journals, but today, maybe it probably switch over to the internet, but back then it was the medical journal. So, like they said in the research article, they said, "Well, that's a good answer." So then they asked the same respondents. They said, "So you get your research from the medical journal? Where exactly in the medical journal?" And do you know what the answer was, Andrea? I think you and I have talked about this before, but do you know where the answer was?
No, I don't.
The advertisements.
Oh my God.
Right?
That's crazy. Well, here's another pretty good example of qualifying someone. I recently learned of a naturopathic doctor here in my area. She's only about 30 miles away. I referred a couple people to her because I had an understanding of one technique that she used, and I thought that was good. And she blessed me with like a massage because I referred a couple people to her. So I went over and I met her. And, I previously, she had ordered the Age Pill, a product that you and I both use, and tried it. And she actually has a condition herself. And I happened to have a natural product with me that day. And she was having this continual cough the whole time we were trying to talk. And I said, I have something that will help you with that. So I gave it to her and she went in and took it. And within 5 minutes, she was no longer coughing. And I was like,
Wow.
Well, I'll just leave that with you, and maybe it'll help you out. And I thought, well, who wouldn't order it, right? I mean, in 5 minutes, she quit coughing. So to carry on, the day I went to visit her, I took her some H2. And she has some like lung issues, and I know it's good for her lungs. And I said, this might help you, and I told her what the quality was, the effectiveness and stuff. And she was like, she's got this little machine on her desk. And she says, well, I'll just put this on here. And there's some way that it measures the energy of the product, right?
Measure the frequency, yeah.
Yeah. And so she put it on there and her mouth dropped. She goes, oh, wow, that's really good. That's like 95%. And I'm like, well, I don't know what that means in your world, but
right.
Yeah, we have good quality products. That's what we've been trying to tell you, But the second thing she said to me is, well, I have my protocols. So she's not even open to looking at fabulous, effective formulas that are formulated to do something, not just take 8 different supplements, and try and get the combination. She wasn't even open to that. And I just walked out of there going, I'm not sending anybody to her. She's not open to learning.
That's exactly.
She's not open to expanding her mind to take in more information that could help her patients better.
That's right. And that's part of the problem is that people have their protocols. They've gotten used to treating the patients this way, and they're getting these results. So therefore, they don't want to wipe the slate and try something new. Because what if the results aren't as good? right? And I can agree with that. What if the results aren't as good? But what if the results are better?
Yeah, and at least do some research, not just dismiss it like you're uneducated about it, so you're dismissing it. It doesn't make any sense to me. So, that's kind of what we decided to talk about today, is how knowledge doubles basically every 5 years. That's what we hear.
Yeah. When you look at that article that I wrote on Facebook, and I was just looking at one of my journals actually, and it was talking about, they discovered way back in the 1700s that the certain molds, if you put it on the top of a glass jar over the top of a fluid, the fluid wouldn't grow bacteria. They noticed that in the 1700s, back in around the time of our American Revolution. And then 100 years later, they found that it would help with antibacterial action in animals. And there was a report on it. Pasteur, he wrote about it in 1897. But yet, it wasn't until 1928 when Fleming discovered penicillin, and then in 1946 when it started to get used. Think of all the millions of people, the hundreds of millions of people that died in that time frame because maybe, we didn't have the internet back then. I mean, we didn't, Al Gore hadn't invented the internet yet then, right? So we didn't have that information, that way of passing on information from group to group. But today, it's so easy to pass information with the internet. Mm-hmm. If you're not keeping up with the information, it's either that you really are too busy, which you should have somebody helping you then and saying, hey, Andrea, read this. Hey, Andrea, read this. It pertains to what you're doing. And that's what the doctors should be doing. But like you said, they aren't, for whatever reason. It's not just medical doctors. It's naturopaths. It's homeopaths. It's chiropractors. I've talked to hundreds of chiropractors that they aren't open to anything new because of the same thing. I've got my protocols. I'm going to stick with that.
And I think that I've heard in the past the term physician actually means teacher.
It does.
I thought so. I thought that I heard that. But this kind of leads me into one of the topics we wanted to talk about, and something that's near and dear to both of us, is stem cells. And, there's a lot of new protocol out there for using stem cells and various ways to use it.
I was just reading yesterday about using it for treating stroke victims.
Yeah. I mean, doesn't that make sense?
Yeah.
And you just talked about all the people who died or didn't get help for all those years because of that discovery that was just left sitting there. Stem cells is the same thing. We've had the knowledge of how stem cells can help the body for years.
Right.
Like 20 years.
Or longer than that. Actually, longer than that.
20, that probably the average person ever heard anything about stem cells. And then they kind of took a left turn with it, saying that it all came from aborted tissue, which it doesn't. Even though,
but back then, most of it was. Okay,
so that's changed.
They were doing the taking parts of the hip bone and taking the stem cells out of there. But most of the stem cells, that was really painful. So you can imagine if I took a drill and put it on your hip, you're not going to like that. And so most of the stem cells actually, the studies were probably done on embryonic tissue. Yeah.
So, we've got this technology that's out there, and how many people, what percentage of the population do you think doesn't know that you can have stem cell therapy for knees and joint hips and your brain and all kinds of things that they're doing with it?
Well, I did a survey on Facebook, just a survey of the people that I know, and it came out with that about 20% really had an understanding, 80%, I mean, they'd heard of it, they'd heard, maybe heard the word stem cells, but that's all the further they'd ever gotten into it.
And, you know, I shared with you last night, my son's neighbor's 12-year-old child did something, used some kind of explosive thing to start a fire, and is now in a burn unit with 95% of his body burnt. And I have seen on the internet for at least 5 or 6 years the stem cell gun.
The stem gun.
The stem gun, and they just spray them with stem cells. And like, there's an example on there of a fireman who was burned, and I think it's either 2 weeks or 2 months, probably 2 months, that you couldn't even tell he'd been burnt.
Yeah.
His body regenerated his skin. So how many people through years have we lost due to bacterial infection because they were burned?
And that's not even really a stem cell gun, Andrea. That's actually a skin cell gun. It's a skin gun. And so they take and they grow skin cells in a lab, and then they can take your skin cells, grow your skin cells, and then they can spray it on you. It's really interesting, yeah, and it's quite remarkable.
And it's sad because every burn unit in the country should have one. Every single one by now should have one.
Yeah.
So that's really sad, you know. And then there's even I've heard of products that don't actually have the stem cells in, but they use stem cells and they pull the growth factors out of the stem cells and put it in things like lotions and stuff like that. And, you know, it does basically the same thing. It's generating that growth of those stem cells. So, yeah, it's really sad that we do have some of this technology and it's just sitting there. So I can't wait, because I really believe that we're going to see an explosion of medical technology very soon. And,
and the explosion isn't just going to be with things like stem cells. I mean, there's so many things going on. There's so many things going on with biotechnology. You know, like here, I'm just going to read a couple quick articles that you know, they found that probiotics help protect the bones, protects against bone loss. They found that lower mortality among coffee drinkers. You know, I thought this was really interesting. They took and they studied almost 4,000 people, and they found that if you make it to the age of 80, your risk factor of dying starts to actually go down. So your risk factor for dying goes up till you reach the kind of that tipping point of 80 years of age, and then it starts to drop, and it actually drops till you're 105 years old. So you've got almost 25 years that your risk of dying actually goes down until you're 105, and then it levels off.
That might explain what's going on in my mother's little hometown. We have so many people that have reached over 100 in that town, and now there's, like, I drove her around Sunday. We drove around town, and, you know, I just talked about who lived where when I was a kid, things like that. And she said, oh yeah, well, and I said, well, who lives in that house now? And she says, oh, they still live there. And I'm like, what? Because they were like teachers of mine in high school, right? 40 years ago. And she goes, oh yeah, she's still alive. She's 97. And there's so many 90-year-olds in her town. So I used to tell her, I'm not drinking your city water. So I'd bring bottled water with me. You know, I said, I'm not drinking that city water. Well, now I go down there, I said, give me some of that city water you've got down here, because it's obviously in the water.
Yeah. Well, and the nice thing, you know, Andrea, is that when you take a look at the older folks, the people over there, you know, really, you're in my generation. We grew up eating whole foods.
Basically,
real
yeah.
Wholesome foods. It was, I mean, I remember we had I lived in a town of less than 100 people, and we had a little grocery store in town where he would grind fresh meat for, if you wanted ground burger, he'd grind it for you. If you wanted vegetables, or you wanted your meat sliced or anything like that, he'd do that right there. He had the slicer, and he sold everything from gloves and hats to meat and vegetables. And I remember the vegetable truck would come into town, you know, maybe every 2 days. So you knew you were getting fresh vegetables because they were spoiling. Where
Right.
Today the vegetable truck doesn't have to come into town so often, and they don't have a grocery store in my town anymore, but they don't have to show up as much anymore, because now they found that they can radiate the plants and prevent the vegetables from spoiling. and it's got to do something to us. And so
Right.
we're not going to have the same advantage that your mom did. We're not going to have the same advantage that my mom did.
Well, we have new advantages, and we're discovering those, extracts of really potent natural substances.
That's right.
But, that takes me down to, we missed talking about, we were discussing the burn victims. We have that product, Sizzle Ripped, that is a blend of amino acids. So normally to build muscle, you eat protein or meat. Meat is protein. Some people don't know that.
I think it comes from the grocery store.
Right. And so you would eat that, and that is amino acids, and your body takes that and utilizes it to build muscle and other things, right? Well, we have that product, Sizzle Ripped, which is basically a blend of amino acids. So you can take that, and that was created for burn victims in the beginning. Dr. Robert Wolf created that after he went through like 200 blends of amino acids to find something that would help a burn victim build muscle back on their body.
Wow, really? That's the original research.
Yeah. And because he had gone into burn units, he was working in burn units and realizing that the stuff they were giving people to build their muscle back was pretty toxic. And he said, there's got to be a better way than this. And so that's what he did. And so anyway, we have that great product. And so, in talking about this, you have these extracts of things that your body needs that you can pull out. And we're learning to pull them out and provide them in a way that, you don't have to have all the other stuff, basically. That's and right. What I've always said is I just want to quit eating food and just give me the pills and the drinks. But I know it doesn't work that way.
I really think that, that's the way we're going. We have to supplement. If you had been at my talks that I gave down in Australia, and I'll give the same talk out in Michigan when I come out there this spring, that you want to get it from your food if at all possible. The problem is that we don't have the nutrition in the soil. We don't have the nutrients that the plant needs. So therefore, that crop is growing and it's looking really, really good, but there's no nutritional value in it. So that's why we need to supplement. And the problem with it is that while we're busy eating all that food that has low nutrition, and it's high in calories. So we're adding all those calories without the nutrition, and we have to look at how do we get that balance? How do we get that balance of everything? And so that's what I talk about when I go out and do my talk.
Well, that's a good topic to talk about because, every once in a while I'll run into somebody who says, like I have one friend who said, well, I'm trying to teach my daughter to get all of her nutrition just from food and not use supplements. I'm like, okay, good luck with that.
Good luck. Yeah. According to Harvard, they say that 97% of us can't get the nutrition from our food. So
I would imagine that, as depleted as our soil is and stuff. On top of that, adding all the toxins to it that they do. But the gut. Let's talk about the gut because so much, just in the last year, really, so much information has come out about the importance of the gut and that it communicates with the brain on so many different levels. And I think people just thought that your intestines was a place where waste products went, they sucked out some nutrition, and then it got processed to be eliminated from the body. And that's all they thought it really did. That's what's been in my mind all these years. Like, yeah, you eat food and it sucks out good stuff and then you eliminate it. You didn't realize there were all these processes and effects of what was going on in the gut, Yeah.
Well, like you said, there's a communication center that really isn't totally understood yet. It's really not, they don't even really know how it works, but your gut actually tells your brain, tells things. There's like a communication, like say you have a red phone that goes to the bat cave and you can communicate with Batman directly. And the bacteria in our gut have that kind of a phone system with our brain. And so if your bacteria, the microbiome in your digestive system isn't healthy, it's going to send bad signals. So it might actually make you feel depressed today. It might make you feel
Mm-hmm.
tired, fatigued, anxious, all these different things because the bacteria are feeling that way. So therefore, so do you.
Yeah, and it does have a direct effect on your hormones, and I have a good example of that too, I believe. I have a friend who has been through some pretty hard medical things, and last summer he ended up with he went in the hospital and got an infection from the hospital, and he also developed C. diff in his body really quite badly. He was in the hospital for 2 months last summer, and I called him and said, well, are they like giving you probiotics? No, they told me to eat yogurt.
Oh,
Hospital told him to eat yogurt. So I met with him at one point, and he could barely walk. He was like shuffling, but the big thing was he was breaking down about every 5 minutes crying. And he says, he'd apologize and he'd say, I'm sorry, I don't know why I do this. And he'd just break down and cry. And then he'd be okay for about 5 minutes and break down. And I said, I know exactly why you're doing that. Your gut biome is so messed up that your mental hormones, all those hormones that control your emotions, are screwed up. And I said, so it made him feel better to know that it's something biological rather than like he's losing his mind, so.
Right. Yeah, isn't that interesting? And like you said, at least the doctor thought about using yogurt. I mean, I have to say,
we're just full of sugar to feed the bacteria.
But actually, think about that, Andrea. How many years ago was it? Maybe, not that many years ago, maybe a year or two ago, doctors weren't recommending even yogurt.
Right. That's true.
And so now at least they've made that advance. Now we just have to go back to that doctor and say, hey, would you read this? That shows that the bacteria that's used to make yogurt isn't actually the same bacteria that is used to build your gut lining. And so that's an interesting subject in itself. I go back in my practice, Andrea, and check this out. I had a patient that had osteoporosis, but she was also on welfare, on medical assistance. And the doctor recommended Tums as a calcium to build the bone. Okay. And I said to the patient, I said, well, that's actually not going to work. I said, it's the wrong kind of calcium. Mm-hmm. And then at the same time, it's a type of calcium that's used to decrease the stomach acidity. And you need stomach acidity to actually absorb calcium. So by taking it, you're actually defeating the purpose. And so she went back to her doctor and she said that. And it turned out the reason that he recommended it, kind of like your homeopath out there, your naturopath that you talk about, not only was it a protocol, but it was a protocol that was covered by North Dakota Medical Assistance. And so North Dakota Medical Assistance would cover Tums as a calcium supplement.
What? That's crazy. Well, just this week, just in the last couple of days, you and I both saw information on social media that was saying that they're now looking at possibly the gut is where diabetes originates.
Yep. Yeah.
So,
and I remember talking to my buddy. Now, I don't know if you're talking about type 1 or type 2, but type 1 exactly, because the research shows that type 1 diabetes is an autoimmune disorder. What happens is that your immune system goes haywire, starts to attack the cells of the pancreas, destroys them, and triggers type 1 diabetes, right? Mm-hmm. And so where did the autoimmune problem come from? It came from the gut.
Right. And so then you have to go back, just like, you have to look back and go, well, what is the triggering factor here? Well, most type 1 people are discovered to have that, I think, before the age of 20, aren't they usually?
Yeah. And what do you know what causes it? What triggers it according to the research?
Well, I have my own theory, but it's an Andrea theory. So go ahead and tell me.
It's actually it's an allergy. It's a sensitivity to the protein found in milk.
Really? Real milk or processed milk?
Cow's milk and cow's milk. No, it's actually from it can be whole milk or it can be processed milk, but the processing, the pasteurization, the homogenization, things like that does its own things that we won't talk about. But there's a type of protein in milk. It's called casein. You got the casein A1, you got casein A2, and the one form is what you find in like what we'll call ancient cows, like zebu cattle. And the cattle that are back in biblical times, the cattle that are found in India, those cattle, they produce a type of milk that's got a really a low, maybe even a non-allergenic type of casein. Where if you look at the commercial dairy cattle that we use here in the States, these cattle produce the type of casein that actually triggers an immune response. They're a genetic hybrid of the ancient cattle. And what happened is that some people, their immune system hasn't advanced as far as the protein in the milk has. So there's one problem with hybridization.
Right. But then we have to look at, that was the old news. Maybe this new news is because it's based in the gut, and we know the gut is being attacked by all kinds of things, glyphosates, toxins, and certain substances that are put in humans, and just basically chemicals on our food and our water, all of that. So let's expand that, and hey, maybe it's really just another byproduct of toxins, and some kids are exposed to more toxins when they're young or not. There was a study done that they did this whole huge study, and every newborn that's born has around 250 toxins in the umbilical cord blood already. The day they're born.
Yeah, that study by the Environmental Working Group, just a great study, right? Mm-hmm. And so it shows things like DDT, right? And DDT's been banned since the 1970s, but it was still showing up in the umbilical cord blood of these newborn babies in the 1990s. And so that pesticide DDT persisted in our environment for 30 years, and hundreds of years.
Probably in our bloodline or in our genetic makeup, because I live about 20 miles from a town where back in the 70s they had a huge problem where fire retardant got put into cattle feed. I don't know if you ever heard anything about that.
Fireproof leather.
You're right. No, they literally went through this entire state and killed all the cattle, killed rabbits, killed anything that had some type of animal feed that could have been exposed to that. And it's still in that area. And I have a friend who goes to my church. She's third generation down, because she's a lot younger than me. Third generation down from that. And even her kids are getting tested, and they're finding that still in their body.
So it's a fluorocarbon, same thing that we use in airplane seats, same thing that we use for flame retardants. And but think about that, Andrea. Think about that. They've killed off all those animals. They're testing children for it, yet it's allowed to be put in pajama material that your kids
baby mattresses and your couch and and a form of it is put into laundry detergent, and so if you're washing your clothes in regular laundry detergent, you're getting exposed to that. Mm-hmm. And you know how we always talk about, or in my head, I'm thinking about it while we talk, that as we talk about things, all the information just kind of circles around, and it's like our entire body is a circle of interactive things, right? And so we were just talking about the gut. We were talking about communication of the gut and stuff. Another article that you and I both looked at was this idea that the fascia of our body is actually an organ in and of itself.
That's right.
And it's a secondary communication to the nerve.
It's connected all the way from the tip of your big toe all the way to the tip of your skull. And so, yeah, exactly. I mean, if I take and if I have a guitar in front of me and I strum the guitar string way down here, I'm going to feel it vibrate way up here.
Right.
And that's how the fascia is. And so any frequency, right? We're talking about frequency medicine, like your naturopath
Yeah.
uses.
Yeah.
That's part of it, is that you strum the string here and you're going to feel it up here.
Right. And so it connects our entire organ, the skin, to every organ in us, you know. So it's, again, it's that whole energy medicine. When we get to the place where we stop looking at our bodies as being biological and physical and start recognizing it as being energy and element, you know, things are going to change very quickly, I think. You know, I think about this in, I went to a friend's house and I opened the cupboard door in the kitchen. He's got Raid up there right next to his food. It's like, for me, it's like, no, there's a lot of energy going from that Raid right into the food you have right next to it. You know, you have to start thinking about what you're exposing yourself to as far as the energy of that product or that energy of that chemical. You know, you really have to start thinking about that, start protecting yourself from that type of stuff. But yeah, this fascia thing, I read through that article and it was saying that let me read it here. So it's traveling through a water-based ECM, whatever that is, you probably know, in our body. And it travels through fascia at the speed of 750 miles per hour, the signal.
Holy cow.
Versus, which is the speed of light, versus 150 miles per hour, which is the nerve signal.
Yeah.
So it's like, what, 5.5 times faster through that new organ they've discovered of our body than the nervous system.
Isn't that interesting? So basically, if I take and I poke you on the bottom of your foot, the signal through the fascia is going to get to your brain faster than the signal through the nervous system.
Yeah, so that's like when you step on a hornet and it stings you. That's why you jump really soon.
That's right. That's right. Well, Andrea, you know, we're getting past the half hour that we normally try and limit the calls to. You know, even though we had a delay in the call and everything, it's still we're about a half hour. You know, as we talk about these things, I think people find it really interesting, and you know, just as a starting point, you know, a lot of people, they say, well, Kurt, you know, I can't go and change everything that you changed. I can't go and do that like that. I can't instantly become, you know, doing a lifestyle like what you have. And Andrea, same thing for you. So the first step might be, let's just get you to change one thing.
Right.
And see how it goes. And you go, hey, that wasn't so bad. And then get you to change one more thing. So maybe we'll get you to change your toothpaste this month.
Mm-hmm.
And you're already brushing your teeth, but now you're brushing your teeth with a toothpaste that's actually healthy for you. And then next month we might say, hey, let's get rid of that toxic shampoo that you have. So now you're doing the toothpaste and the shampoo. Now let's take and let's change your laundry detergent, get rid of some of those fluorocarbons that we were talking about that they're banning in the state of Michigan, and they should, because they're finding it in all the water. You take a look at what Aaron Brockovich used to talk about. I mean, that's the stuff that's found in the water. That's what they're finding in the water. We're worried about lead and things like that, but really, there's a lot worse things than that because we just aren't watching them. But if we can get people to change that little bit at a time, and then as they're changing those things, then they can read up on the things you were talking about, like the age pill. They can read up on, you know, like even your naturopath, if you just got her a little bit of information and something caught her eye, it might not be this piece of research today, but you might send her another piece of research, and somewhere along the line, something's going to catch her eye. And the information that catches my eye is not going to be the same as what catches your eye. Right?
Right. Yeah. And, you know, we talk about that and like starting with just that. And I think we all did that. We all started, and that's why we do these calls, so that you can acquire some knowledge, right? So you can start to understand some things. And that's why we did this whole topic today, that be proactive about learning things. You know, it's like yesterday, I took a friend he had cataract surgery on both eyes, I think about a year ago.
Mm-hmm.
Took him to the doctor because he was getting a lot of blurriness in one eye. And so he was afraid that, you know, his cataracts were coming back or something, even though typically I think, you know, the surgery is good for about at least 10 years, they say. But I'm sitting there waiting for him to get done in the doctor's appointment. And I thought I was, you know, playing on Facebook, and I got tired of that. And I went, well, what's the underlying cause? Because there's really an underlying cause to everything. You just have to know the underlying cause and correct that. So I thought, well, I wonder what causes cataracts. I did the simplest search, just went into Google and put what causes cataracts. Guess what? Oxidative stress.
No.
That's what causes cataracts.
Yeah.
So I'm like, I post, guess what causes cataracts? Do you have cataracts? Guess what causes cataracts? I found several articles. That is the base of cataracts, oxidative stress. And now we have hydrogen water. You can drink hydrogen water and have a preventative measure against cataracts.
That's right. Yeah. I think, you know, and I haven't tried it yet, but I think that adding a little bit of hydrogen water to like an eyedropper,
mm-hmm.
based on some of the stuff that I've read, the best antioxidant known is diatomic hydrogen. Why couldn't you just take and mix it into a little eyedropper, put it in your eye, and wouldn't that help?
I already do that.
Is it working?
Yeah. Well, I've only put it in 3 times. I don't think you have to do it like all the time. You know, I think it works really quickly, actually.
Well, it goes right to the brain. You know, if we're talking energy medicine.
The eye, you know, I mean, you got gunk in that eye. There's stuff in there. And more I hear so many people, well, I have to go get these shots in my eye, and I have to do this, and I have to do that, and I have a film inside my eye. I can't see well. You know, all of that. I had that years ago from staining furniture for 3 years. When I got done doing that, and my health was the reason I quit doing that, I had like black floaters in my eyes, really bad. Like if I swam underwater and looked up, like you'd just see them gooping in there, you know, or if I looked up at the sky, you could see it really good. And I ended up utilizing some drops in my eyes that, you know, removed toxins and stuff and cleaned it right up. And I hardly put it in there at all, but it cleaned it up. So I think just using this like every couple of days, whenever you mix up your hydrogen water, you know, I just put it on my fingertips and look up and sprinkle it in my eye. That's all I do.
There you go. Well, yeah. I mean, you're seeing results with it.
Well, my eyes, you know, it's good for inflammation. And you know, when you have little grandkids, they tell you everything like, oh, your breath is bad, you know, or what's this flabby stuff under your arm, Grandma? You know, all that kind of stuff. They don't hesitate to point out all these things that you don't want them to notice. But, you know, my grandkids before have said, why do you have all those little red lines in your eyes? You know, because I had like a breakdown of capillaries in there or whatever, you know, and they say, why are your eyes red? And why are, you know, and I've noticed that my eyes are whiter after I put it in. So I think it removes that inflammation that might be in your eye.
I'm going to try it. I've been talking about it. I'm going to try it. I just, you know, I think like your naturopath, you just get in a routine of your daily activity and you kind of forget to do that.
Right. Yeah. I just pull out my bottom lid and put a drop right there and just let it sit there. Cause you know, that hydrogen's going to go right into your eye.
Yep. You notice my eyes are really half closed today.
Yeah, don't put glass in them.
Yeah, I'm still half asleep from Australia. I'm still running on a 17-hour time difference.
I bet.
Yeah, but I'm getting better. I'm getting up. My dog wakes me up at 6:30 in the morning. I'm trying to get to bed by 11, so I'm at least getting 7.5 hours sleep.
Mm-hmm. Right. Well, hey, it was great having this conversation with you today, and I hope that it inspires people to be more proactive in their health and to seek knowledge and you know, have new conversations about things.
Yeah, start out with just one little thing like Andrea and I talked about. Maybe your toothpaste. We can help you out with that. Get to the person that brought you to the call if you need to get a hold of me or if you need to get a hold of Andrea. You know, we're right here on Facebook all the time. So, Andrea, I'm gonna let you close out the call.
Okay, well, thank you, Dr. Kurt, for being here again every Tuesday at noon. We have the Sizzle or Doctor's Clinic. We changed the name, Doctor's Clinic, with DocFizz and Friends, and you can always go to that page if you're not connected there yet and you happen to see this little video from someone. Ask them to get invited to that page, and you can tune in every Tuesday and see us live.
Thanks, Andrea. Everybody have a great day.
Bye.